Hi, my name is Laurie Pepin, and I'm here today to talk about lymphedema. Lymphedema is a condition where there's a buildup of lymph fluid in your body tissues just underneath the skin. This buildup causes swelling, also known as edema, most often in the arms or legs, though it can occur in the face, neck, abdomen, or trunk. Lymphedema differs from the typical swelling you may get from a sprained ankle or bruise and won't go away on its own. Secondary lymphedema, also known as acquired lymphedema, refers to lymphedema that occurs as a result of infection, surgery, radiation, trauma, malignant tumors, or anything else that changes or damages the normal healthy lymphatic system. You're here today because most likely you have breast cancer-related lymphedema, which has occurred as a result of a combination of several of these factors, such as lymph node removal, surgery, and radiation. Infections that go untreated in the area involved may also be a triggering factor for your lymphedema. Your lymphedema can develop immediately postoperatively, but it can also occur weeks, months, or even years after. What are the signs and symptoms of breast cancer-related lymphedema? They include swelling of the arm or chest wall on the same side of the surgery, your skin feeling tight or difficulty fitting into clothing in a specific area, such as the top of your arm or your wrist, and a loss of flexibility in these areas. It may also include a sensation of fullness or heaviness in the affected body part, skin discoloration or thickening, discomfort and aching in the affected limb, and a lowered immunity of the affected limb so that you're more prone to infections or slow to heal from small nicks and scratches. What should I do if I think I have lymphedema? It is important to seek medical advice if you notice persistent swelling, as early diagnosis and treatment can improve both your outcome and the condition. In the immediate postoperative period, it is also important to rule out other potential causes of swelling, such as infections or seroma, as these require treatment and can be resolved. In the first few weeks after surgery, you may also just be experiencing normal postoperative swelling. Your doctor can help you figure that out. How is lymphedema treated? Lymphedema treatment focuses on reducing the swelling of the affected body part and controlling the discomfort. Generally, treatment can be divided into two phases, the acute phase and a long-term phase, sometimes called the maintenance phase. The acute phase consists of four components and typically lasts 2 to 3 weeks for lymphedema involving one arm. The steps are as follows. 1. Manual lymphatic drainage. This is a specific and gentle massage-like treatment that moves the excess lymphatic fluid from the involved area to other areas of the body. Compression bandaging. Compression bandaging uses short stretch, low elastic bandages wrapped around your affected limb to encourage proper lymphatic flow and prevent further swelling of your arm. If available, a lymphedema therapist may initially wrap your arm and, depending on your situation, show you or a family member how to self-wrap. These bandages are worn day and night as tolerated for the first 2 weeks, and afterwards only as night as needed. The goal is to reduce the swelling and size of your arm, and then to get fit with a compression sleeve that you will wear during the day. Skin and nail care is one of the most important and overlooked parts of lymphedema self-management. The goal is to prevent infections such as cellulitis before they occur, as they can lead to a bigger and more painful arm. It is important to maintain proper cleanliness, moisturizing, and self-inspection of the skin on your affected limb. Protect your involved arm if working outside from sunburn, insect bites, thorns, scratches, and anything that could break the skin. Exercise is the last part of self-management for lymphedema. There are specific lymphedema exercises that focus on the gentle contraction of the muscles of your arm while you're wearing either the bandages or a compression sleeve. What can I expect in the long term? Once the volume of swelling has been reduced in your arm, It will be important to continue with the basic 4 principles you learned in the acute phase. Continue to stay active and monitor your skincare to reduce the risk of complications. The long-term phase does transition to the use of compression garments, which are long sleeves and, if needed, a glove, which compress your arm and hand and encourage the flow of lymphatic fluid, as well as keep the arm from swelling more. Many women who are diagnosed with lymphedema are able to successfully manage their swelling and keep their swelling to a minimum using these techniques. Is there anything I need to look out for? The number one precaution to be aware of is signs of infection, as these can be life-threatening if left untreated. A sudden increase in swelling, accompanied by redness, streaking, extreme tenderness, fever, and malaise, are signs to call your doctor immediately. If you suspect you have an infection, stop the self-manual lymphatic drainage so you don't accidentally spread the infection. You can continue with the compression part if it is comfortable, but not if your arm is so swollen that it feels like a tourniquet. Again, follow the instructions of your doctor until your infection is healed. In closing, I want to thank you for your attention. I know this is a hard time for you if you're watching this video. Please refer to further videos or instruction for the different aspects of self-care. Best of luck.